But really, is this morning sickness? Morning sickness is the term used to describe the nausea where you feel like throwing up and vomiting that women experience during pregnancy. Though it's called morning sickness, it can happen at any time during the day or night. The exact cause for morning sickness is not known, but it's most likely thought to be caused by the hormonal changes that your body is going through. Morning sickness doesn't usually harm your baby, but it can affect your quality of life. Morning sickness most commonly begins before the 9th week of pregnancy and is most commonly experienced during the first 3 months of pregnancy. Some women, however, can continue to experience morning sickness throughout their pregnancy. It can be brought on by smelling specific odors or eating certain foods, but sometimes it can happen without any external stimulus. Sometimes your nausea and vomiting is so severe that you lose about 5% of your pre-pregnancy body weight. This is known as hyperemesis gravidarum, and this requires medical intervention and sometimes hospitalization. Some risk factors which make you more likely to develop severe morning sickness are being pregnant with twins or multiples, having a previous pregnancy with severe morning sickness, having a history of motion sickness or migraines, having a family history of morning sickness where your mother or your sister suffered from severe morning sickness, and if you're carrying a girl child. Some things that you can do at home to help with morning sickness are eating a cracker or a dry toast first thing in the morning before getting out of bed, eating frequent meals, eating small bites of food throughout the day. You can nibble on crackers or nuts or fruit, taking your vitamins, avoiding smells or foods that make your nausea worse, eating bland foods that are not too greasy or spicy, drinking plenty of water. Ginger can sometimes help with morning sickness, so drinking some ginger tea or ginger ale made with real ginger can be helpful. Frequent vomiting can damage your teeth. Rinsing your mouth with a teaspoon of baking soda dissolved in a cup of water can help protect your teeth by neutralizing the acid from the vomit. If these don't improve your symptoms, you might need some medication such as vitamin B6 supplements or doxylamine. And if your symptoms still don't improve, you might require some prescription medications. In most cases, morning sickness goes away or improves by the second trimester. But if your morning sickness is getting worse or you're experiencing some of these symptoms such as having no urine or having very little urine that's dark in color, not being able to keep down any fluids, feeling faint or dizzy on standing up, and having a racing or a pounding heartbeat, reach out to your doctor right away. These might be signs of dehydration and you might require medical attention.